Hello, everyone. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Monday, January 24th. We are coming to you after an exciting weekend of football to talk about the impact of the COVID-19 outbreak on Mobile County, our residents, our guests, our workforce. So yesterday, 500 cases of COVID-19 were reported to us. That takes us to 103,357. When we last spoke on Thursday, I had said that by the time we talked again, that we will have gone over the 100,000 mark, and we did over the weekend. We often see low case counts following a weekend because fewer people are seeking care. There are fewer testing sites available. And again, remember that we know that the count is going to be lower because of the closure of our community testing facility at the Festival Center. So again, 500 cases yesterday, 0 deaths reported yesterday, and 45 additional COVID hospitalizations. Over the last 6 days, we've been hovering just around 300 people in the hospital with COVID-19. It's good that it looks like nationally and locally that our case count, or the number of cases detected and reported to us, has plateaued or is going down. Looks like hospitalizations may be plateauing. The number of deaths, while we had no additional deaths reported in the last 24 hours, we have seen a slight uptick in the number of COVID deaths reported to us. So again, cases, hospitalizations, percent test positive has gone down. If you look at our weekly expanded report, it's gone down to 37%. That's still much higher than the 4% we saw in early December, but it is going in the right direction. The number of provider visits, so doctors' offices, emergency departments that are attributable to COVID-like illness, is going down. That is good news. But again, the number of deaths are increasing slightly. So we will continue to keep an eye on that. Just a little bit more information about COVID hospitalizations. Let's see, in the last couple of weeks, we've had nearly 500 people discharged with a COVID-19 diagnosis. About 16 to 17% of those required intensive care, and of those in ICU, only about less than 40% required mechanical ventilation. It looks like, as we've discussed, that people are not as sick, though that we know there are some people, even vaccinated people, with underlying medical conditions that are going to be hospitalized and could lose their life because of an Omicron infection. If we look at hospitalized, about 9 to 10% of those are in children. About only 20% of people hospitalized are vaccinated. Among our deaths, about 90% of people are unvaccinated. So only 10% of people who die with COVID are vaccinated. That's the general population. Things are a little bit different in nursing home settings. So, in the nursing homes around the state and long-term care facilities, assisted living, memory care, nursing homes, that's kind of a broad category of long-term care facilities. But most of the residents in long-term care facilities are vaccinated. In some locations, up to 84-85% of the residents are vaccinated. But last week, for January 10th through the 16th, and this is statewide, not just in Mobile, but statewide, there were 755 long-term care facility residents who had COVID-19. About 71% of those were vaccine breakthroughs. So again, a large proportion of the population there is vaccinated. It is slowing transmission, but not preventing transmission in this very intense congregate setting. But the illnesses are much less severe. And this is what the power of vaccination brings you, and that the 755, only 2% of those required hospitalizations, and only 1% of those passed away from COVID-19. So any death from COVID-19 is tragic. Any untimely death is difficult on family, friends, coworkers. But we are seeing a much better situation in our long-term care facilities than we have seen previously. In fact, right now, the number of resident cases in long-term care facilities is almost as high as it was last year this time, when we saw a really big surge of of Delta. But again, the number of long-term care residents requiring hospitalization is like crazy low, only 2%. And again, a very small percentage of those have died. So we're very thankful that those facilities who have achieved very high vaccination rates, the vaccine seems to be doing what it's intended to do, which is keeping people from requiring hospitalization. Most of them have an illness that can be managed in the facility. A little bit of information about our vaccine rates. So in the report that I looked at today, about 55% of the eligible population has received at least one vaccine, and only 46% are fully vaccinated. So most of the younger age groups, so those 50 and lower, those are the age groups that we still are seeing lower number or lower percentage of vaccination rates in those populations. So we really need those younger populations to get vaccinated. Interestingly, if you adjust for the population, the Asian population has the highest vaccination rates, followed closely by white and black or African American, which are almost identical. So it is quite interesting that folks out in the Bayou and Coden and areas where we have, and other parts of the county where we have large Asian populations, where they're doing a really good job of getting vaccinated. And then in general, female are more likely to be vaccinated than men, but I think that that is not a surprise to anyone. All right, a few other announcements. I just want to remind you, when we're talking about trends, and I've received a question today having to do with Mardi Gras. I get those all the time, it seems like, these days. But if you will just remember that we have two things in Mobile County that are really going to have an impact on the trend of cases. One is that our COVID clinic, our walk-in testing clinic at Festival Way closed at the end of day last Wednesday. We don't have enough resources and test kits to keep that facility open. So, we were adding about 300 cases a day to our trend line. So we're, not seeing that anymore. And then also, you have heard and read, and hopefully you've signed up for the at-home or self-test program, where the federal government is promising and starting to distribute or plan to distribute. They're already taking names, of course, at-home test kits. Tests that are performed at home are not reportable to public health. We do not want you trying to go on our portal that's used by doctors and report your COVID positive test. That's not what that interface is for. So we are going to lose some visibility on the number of people in our community that test positive for COVID because of these two factors: closing our clinic and the increasing use of at-home tests. So we will continue to keep an eye on things like hospitalizations, because those numbers get reported to us directly from hospitals. So that will be our sort of indicator for how things are looking in the community, as we continue to see probably a reduction in the number of cases reported to us because of reduced transmission, because of limits on community testing that's available, and because of the increased use of at-home tests. And just want to remind everyone that right now 100% of the COVID that we're seeing in Mobile County is Omicron. So, indeed, in some people, Omicron, even though it is less severe, for most people it is causing hospitalizations and deaths. All right, the question was about, I said last week, I think, or sometime, that the predictive models are showing that we are on the decline of COVID cases, and that our number of hospitalizations and deaths are peaking between now and the end of the month. And I made the comment that the prediction modelers probably are not taking into account Mardi Gras when they're developing models, predictive models for the state of Alabama. And it's just, I don't know what's going to happen with Mardi Gras, with more people in the streets, in indoor social settings, balls, other social events, in bars, and out in the streets with parades and that sort of thing, we could see a second small bump in the number of cases reported to us. We could see nothing at all because, again, about this same time, we're seeing a transition towards more at-home testing and less community, a less availability of community testing. And then it also could be that we see a downward trend, and that I don't think Omicron is going to burn out by Mardi Gras, but I do think that it will continue to go down. And, we've not seen a huge spike or not heard about huge spikes in COVID directly related to things like bowl games and large outdoor, football and other sporting events. So it may be that the parades may have very little impact. We may not see anything. It certainly seems like because of some of the big college playoff games and bowl games and some of the recent NFL games that we're not seeing or hearing about, shockingly bad outcomes around those things. So hopefully that means that people are vaccinated, they're taking things seriously. Omicron is less, severe, even though it's still way more infectious. So, fingers crossed that we don't see a bump, but I just don't know what to expect as all of these different factors come to a confluence around Mardi Gras. All right, let's see a little bit of information just to talk a little bit more about, remember, the Festival Center location at the corner of Airport and Mont-Lamar is still open for vaccines. So we are still providing Pfizer, Moderna, and Johnson & Johnson vaccines there. It's open Monday through Friday from 9 until 6 and Saturday from 10 to 1. So those hours are just slightly modified from when we were open for testing last week. So Monday through Friday, 9 to 6, and Saturdays from 10 to 1. In our news release, we provided information about where you can go to find a COVID test. So there is a federal location, a website where you can go to find community-based testing locations. The Alabama Department of Public Health has a website where you can seek testing locations. They have about 18 listed in Mobile County. And then again, if you have not already, please go to covidtest.gov to register to get four test kits through the mail delivered to your location. And then also remember, for vaccines, we are offering vaccination using Moderna to anyone who has a physical or health reason for not being able to get out of their house and get to a vaccine clinic. So you can go to our website at mchdcares.com and click on the Request at Home Vaccination tab. I think on Wednesday, they went to 11 homes and vaccinated 14 people. And we had a shorter day on Friday due to a delayed opening because of the weather. And I think they visited maybe 6 homes and vaccinated 9 people, something like that. So please, if you are not able to leave your home, whether you have a transportation limitation or a mobility limitation or a health reason, please take us up on that opportunity to get vaccine to your house. We'll vaccinate you and then any other caregivers that are at your location. And then one other spot for testing, going back to testing just a minute. If you go to easytesting.com, the vendor that the state health department and several other state health departments is using to provide COVID-19 testing in parts of the state. There are 4 locations around the state of Alabama. Again, this is at easytesting.com. One of them is in Baldwin County at the Baldwin County Central Annex at 22251 Palmer Street in Robertsdale. It's open Monday through Friday from 8 a.m. to 6 p.m. So I think you get the results back in 24 to 48 hours. They're asking for pre-registration, though it's not required. There will be no out-of-pocket charges, but bring your insurance and your ID with you. If you're uninsured, please go ahead and come. Just bring your IDs. And I think that is it. The other 3 locations, just in case you're interested, there's one at the Eastdale Mall in Montgomery, one at Enterprise State Community College in Enterprise, and then one at the Hoover Metropolitan Complex in Hoover. So again, in Baldwin County, it's in Robertsdale at the Baldwin County Central Annex. Okay. Mark's reminding me to say something that I forgot to say. Okay. So on our website at mchdcares.com, we have a statement there that says even though the Mobile County Health Department is no longer able to support community testing using a walk-in method at the Festival Center, we can still accommodate by appointment testing at our Family Health, our primary care division. So if you need or want a PCR test for us, those go through a private laboratory. You have to schedule a doctor's visit through Family Health, our primary care division. So you can call 251-690-8889 to get an appointment with a provider to get a PCR test at MCHD Family Health. There will be a charge for the doctor's visit, but it's based on your insurance or your income. So if you don't have insurance, we use a sliding fee to determine the cost. The minimum out-of-pocket cost based on income is $10. You must bring your identification, proof of income, insurance card, and if you have insurance and you know that you have a copay, you need to bring your copay with you. So that is still a way to get COVID tested through Mobile County Health Department through our appointment system by seeing a provider. All right, any questions? All right, hearing none, we'll end our report for today, and not sure if we'll be here on Thursday. It really just depends on if there is new information to share with you. So keep your ears and eyes tuned to our social media, and we'll talk to you later. Protect yourself, everyone. Stay at home if you're sick, and wear a mask that fits you well, and wear it consistently to protect yourself and others. Thanks a lot.